All right, we're going live, and we're going to wait just a couple minutes for everybody to join us.
How's everyone doing today?
I'm Dr. Jans from the Alternative Healthcare Center. I'm actually very happy to reach out to everybody. We miss our patients, all the doctors and the staff. We still are technically open, but because of the ruling from the governor, we basically can only handle emergency visits, and we're doing phone call consults, and we're also mailing nutrition to patients and doing drive-through. So I've got a lot of things I want to cover, but I want to cover some key points.
Let's wait a few more minutes. We're just waiting for people to
Okay.
jump on.
All right.
We got a couple people. Let's just wait a few more minutes. And
All right. We are going live from the basement of 51 Bellevue. We're going to cover some key points here today. I'm just going to wait a couple minutes to let everybody join in.
this is our makeshift little adjusting testing area in our own home. So this isn't our usual clinic setup, of course.
Right. You ready to roll?
We gotta just wait a couple more minutes and let's see if we can wait for a few more people to jump on. We got a couple people here. All right, well, why don't we get started? We have several people that are jumping on, and go ahead and get started.
All right. So what I wanted to cover was a term that I coined to make more sense for the patients, and I was looking at why do people get sick and why do they stay sick? And what the terminology I'm going to use is called stuck points on the body. If you remove the stuck points on the body, then infection or a chronic issue in the body will clear much faster and much easier. So when we talk about stuck points, they can cause you to get sick and they can keep you sick. So with this current virus going around, you have to handle stuck points. And I'll give you a quick example that just happened. It looks like my son picked up the coronavirus at chiropractic college. And when I talked to him, I told him to drain his body out with a lot of Antranex and Spanish black radish, but because I worked on him, I knew his stuck point was his kidney. So what we did was made a cocktail. We put lemon juice, and we put a product called Kidney Tone, and we put a product called Buco, all together in one, and he drank that, and within about 12 to 14 hours, maybe 15 hours, he texted me back and said he's 90% better. Now you might be thinking, what would the kidneys do for the lungs? You know, because the coronavirus causes problems in the lungs, in the sinus area, the throat, and it's basically a virus where the danger lies with it is, especially with the elderly and immune compromised, it can get in and cause a viral pneumonia. But because when you have a stuck point, obviously he has issues with the lungs and the sinuses, but the kidney was where things were trapped. So as soon as you let the kidney go, then the lungs cleared up. And again, just to clarify, we're not treating infection, we're just boosting the immune system and making the body work properly. So you can have, like with the kidneys, a lot of you that are patients, you've been treated with Buco, you've been treated with Solidago, fast food, Arginex, etc. And if you know you have kidney issues, you typically have problems with back pain. And I'm going to bring one of my two beautiful daughters in right now. This is Skylar, and you're going to stand right in front of me, hon, and then turn around. So your kidneys are back here, and they're up a little higher than the lower back on the left and on the right, and it can be one of the big jam points of the body. And one of the symptoms you can have, it's not always urinary. You don't always have a urinary tract infection. You can just have you can have dribbling with urination or a lot of urination, but some people have, male or female, is back pain. They'll just have back pain right in this area, and a lot of times, being a chiropractor, you think, oh, it's their back, and a lot of times it is actually the kidney. So what you can do with this is, besides the actual design nutrition, when I use that terminology, design nutrition, it's actually very specific nutrition for a specific area. This isn't like just grabbing vitamins and minerals and shotgunning and hoping you get well. This is precise nutrition that helps the strength of the immune system, the strength of the organ for the kidney. That would be applied, but you can also eat asparagus. It's a great food to flush out the kidneys. Lemon in your water is lethal to viruses. So that cocktail I made had lemon and bucco and kidney tone. Kidney tone, the word tone and kidney means drainage. Actually, it just helps clear the kidney. So if you have kidney as a stuck point, you wouldn't want to eat a ton of protein, especially when you're sick or if you're getting sick. So that's one of your exit routes. One of the other exit routes of the body is the gallbladder and the liver on the right side, right in this area. And that connects with the colon, so I'm kind of putting, when I wrote it down, we separated them, but they actually work together, the liver, gallbladder, and the intestines. So an obvious stuck point can be you're getting sick, or you are sick and it's not clearing, and you're constipated. And people with constipation think that going every other day is normal or every 3 days is normal, and that can be the stuck point of why you're not getting rid of a virus or a bacteria, etc. So head lettuce has no nutritional value, works great on constipation. Chia seeds, ground up flax, whole food fiber from Standard Process not only has fiber. When you add fiber, you move the bowel easier, but it also has nutrients in there to help what's called the biome, or the natural bacteria that are there. So if you get the bowels moving, then you release that stuck point, and then the body can get well. And it's interesting because a lot of people have a chronic sinus infection. The sinuses are above your eyes or below your eyes, and it's just chronic, or they're sick with sinus congestion, and you get the bowels moving, and voila, the sinuses open up. Yes, Skylar is my comedian, you guys. She'll entertain you. So sinuses are interesting. I'll tell you that I had a patient years ago that chronic, I did everything on her, all these things I'm telling you, and all she needed was trace minerals. And that cleared it up and it was gone. So sinuses typically, that's where a lot of infection starts for people in Michigan, because look at the weather. It's going warm, it's going cold, and those temperature changes cause you to get clogged up, and viruses and funguses and things can jump in there quite easily, and they can get you very sick, or they can become chronic. So, and right now too, I wanted to add this also. Everyone that gets sick, the first thing you're going to think is what? You know, if you got a sore throat, lung congestion, you've got the coronavirus, right? Not everybody does. There's still plenty of people that are getting the flu and getting strep throat. And the other thing that's been added into the equation, unfortunately, is that we were seeing just last week and currently is tree pollen is floating around. And then mold counts go up, and you add allergies into stress and all this other things happening, then you can pick up an infection easier. So basically, you want to clear these stuck points. So for the gallbladder, like AF beta food, choline, there's Livaplex, Livitrit Plus from Biotics, number 61 from Systemic Formulae. You clear the liver. And when you clear the liver, some magnificent things can happen as far as being ill, but also just the body doing well. I didn't tell my wife this, but I'm just going to give you an interesting story on her. She was trying to lose weight and was very frustrated, and we did the 21-day cleanse, and that typically makes her feel better but doesn't have her lose weight. So we added a bunch of these drainage remedies which release stuck points to her body. We did the liver and we did the kidney at the same time, and you lost, how much was it?
Almost 35.
Almost 35 pounds over about how many weeks?
I want to say 8.
Yeah,
It was fast.
She did an interesting thing. She continued the 21-day cleanse because it wasn't working. She told me, she's Italian, she told me that she's going to continue the cleanse, and I said, all right, go for it. So she lost, that's a lot of weight, and that cleanse is not designed to lose weight, but because of releasing these stuck points, then things shifted. So we also have congested organs. So any organ can get congested, like the lungs, as an example. So what you can do for the lungs is Antranex, Spanish black radish, fenugreek, which is fenugreek, the fenugreek seed. If you take that on an empty stomach, and I want to just warn people, if they go grab fenugreek, that's fine. I'm very partial to the standard process fenugreek, but when you take it on an empty stomach, and you have to take a large glass of water with it or it won't go into solution. Why are you nodding your head?
I'm just agreeing.
She's probably never even heard of the product. I'm only messing with you.
I know.
All right, so the fenugreek is taken on an empty stomach, and it gets that deep congestion out of the lungs. Lung 80 from Systemic Formula works really well. There's Antranex, there's D-Hist is another product, Sinuplex from Metagenics. So what can you do as a patient? You can, if you know it's going down to the lungs, Pulmonest is a great drainage product to get it out. Allernest can help. But you also, and I'm going to have you go face down, Skylar.
Now, can non-patients take this stuff? I mean, like in a current situation where everything's shut down.
Yeah, because we're down to phone consults. I mean, we're all three doctors, Dr. Jeff and Dr. Shell, we're all educated in these areas, and we can make pretty darn good predictions just because of what we've been doing. So yeah, at this point, you know, we have to, that's what you'd have to do is just go for it. So what you can do with the lungs, a couple things can be a stuck point. Obviously the congestion can not allow the bug to release. So you can take your hands like this and you can cup the lungs. You can put your husband down or your wife down or your kids, and you just, and it's a little bit rough, and you just go, the lungs go down quite low, so you got to go all the way down the sides, all the way up, and you just keep cupping and do that for several minutes, and a lot of times a lot of phlegm will be coughed up. I think Bella wants to be cupped. So you can just keep doing that, and the other thing, talking about stuck points, your spine can be out of place in the middle here, in the thoracics it's called, or up in the neck, and there's a stuck point right there, and the nerves flow out of the spine and go into the lungs. So sometimes just adjusting the middle back or the neck area will help that to clear. And then obviously, and I think most people know this, but not everybody does, and you want to be completely off dairy if you have any lung symptoms. You want to be off dairy right now anyway, because some people are allergic to it and it causes phlegm, and some people are not allergic to it and it causes phlegm. So in other words, either way you're getting congestion and phlegm from dairy, and that includes cheese. And the worst possible food you could eat right now, as far as getting sick and staying sick and creating a bigger stuck point, is ice cream. Because you've got sugar, which feeds infection. Remember that, sugar feeds infection, and dairy, which causes phlegm. So avoiding those things can be very helpful. Also, turn on your back for me. What you can do is the belly button, the navel, is right here on me. So I would go up about an inch, and just over slightly, and you can lay the person on their back, and you can do this yourself and take your fingers and you can push in, and you'll feel this hard spot, and it's a kidney flush point, and you can just hold that for about a minute, and you can flush. I'm doing the right kidney right now, or you can move over into the left kidney. Now actually she has a little bit of stress on the left kidney. It's not bad, but you can feel that spot. Yeah, she's not liking when I push on the left kidney. So remember, lemon juice, asparagus, bucco, etc., because there's a little bit of a stuck point here. Shame on Dr. J letting his daughter's kidney get stuck slightly. So you hold that, you can hold it for a couple minutes, and there's a couple things that you can do actually on the organs.
People are saying hi to you, Skylar.
Hi.
All right, the other thing is let's go over drainage. We still have some time? Okay, let's go over drainage. Because this was started to be developed by Dr. Dick Versendahl, who did contact reflex analysis, an alternative technique in chiropractic and for other doctors. And then it was developed, refined, improved, and really got to a point where it was a much higher level by Dr. Freddie Ullin. And what he found in his research, and what I have found to be true myself and Dr. Jeff and Dr. Shell, is that drainage is the key when someone's ill. Because if you don't unblock these things, these stuck points, then the body stays sick or gets sick. So drainage is Antronex. So some people, like Immuplex is used to boost your immune system, right? So you've got Cataplex AC, Immuplex, Echinacea C, Conjaplex, Bactrex, all these different products, ADP from Biotics, etc. They push the immune system, but some people actually get stuck in their own filth as they're trying to get the garbage and the bugs out of what's called the lymph, which is the drainage part of the body. It gets stuck, and some people actually feel worse because they don't have enough drainage. So it's more logical to give a person like 3 Immuplex or 6 Immuplex, and when they're getting sick or are sick, you could give them 9, 12, 15, 18 Antronex spread out, or maybe 12 Spanish black radish spread out through the day to drain all that gunk and mucus. And the Fengree that we mentioned is another product, and all these liquids that we talk about, like Hepatica for the liver, and Buco and Solidago for the kidneys, etc. All those things drain the body. So you open up those channels and the body feels better. And on that point of stuck points in the body, sometimes it's just inflammation. I mean, I have patients who they get chronic pain over on this side where the pancreas is, because the pancreas just gets beat up with the American culture. We eat white flour, white sugar, we eat a lot of dairy and tons of sugar. Sugar is very hard on the pancreas. And there are products, and I'm going to give Standard Process a shout out in a positive way. They're called PMGs, and a lot of you that are patients are on these: Thytrophin PMG, Pancreatrophin PMG, Hepatrophin PMG, Renotrophin PMG. And what they do is a way different thing. It's not really, in my opinion, it's not so much acting like a nutrient. It's more of a product that gets your body to stop inflaming the organ and give the organ a break, sort of like stopping attacking yourself to some degree. It kind of decoys the inflammation stress off that organ, gives it a break so other nutrients and other foods that you're eating properly can get in there and heal the body. So that would be, in this situation, would be pancreatrophin. So that's the beat up gland right now, especially in the United States. And you've also got the spleen, which is over here for a lot of people who have autoimmune conditions like lupus and Hashimoto's and Graves' disease, etc. That area that would come and play what's called spleen PMG. So that's another, I'm putting this in the category of stuck points. That's another stuck point, is the organ gets so inflamed that the body kind of almost disconnects from that area and thinks it's foreign tissue and it's attacking it and annoying that area completely. So you use those PMG products to release, which leads me into the key factor with the current situation, the one I didn't mention, pneumotrophin. If you have a cough, if you have congestion, if you take a lot of pneumotrophin, you might have to take up to 9, 12, 14 a day for a while. It helps tremendously with the cough because it takes the stress off the lungs and allows that stuck point to release so congestion can come out, etc., and the body can get well. And all this being said,
so can you explain,
Sure.
just in case, because there's, videos such as this get shared, and there may not be actual patients who are familiar with the supplements. So, just a quick explanation of how that's different than medication, because when you're talking in volumes of 12, 15, 20
Right.
a day, they
So
might go,
No, good point, because you want to be, these high doses that I'm talking about, it's being aggressive. Like when I mentioned my son, he was taking I think 30 drops of the bucco 3, 4, 5 times a day, and he was also taking all sorts of the kidney tone to flush him out. And the lemons, don't forget the lemons. And these are just some of the products that we use. They're very what we call design nutrition, which is specific, but when you're sick or getting sick, you have to hit the dose very hard, because like a medication, you would never do this because you could end up in the ER. These are not drugs, they're nutrients. They're whole foods, they're herbs, they're homeopathic remedies. And by the way, a lot of people have a misunderstood word with homeopathic. Homeopathic is not a nutrient, it's actually a wavelength. Because all your cells, if they're healthy, they vibrate, you know, at a certain frequency. When you're sick, if you have cancer, if you have a cold, whatever your illness is, the cells usually slow down in their vibration, and homeopathic remedies get your cells to vibrate at the correct rate, the healthy rate, and it helps tremendously to get well. And it's also a great tool, because if you have a baby or you have a young kid, it's hard to get nutrients into them when they're 1, 2, 3 years old or an infant, but you can put drops on their tongue that are homeopathic that can help with the immune system or help detox. OS is an example that helps these stuck points, which even infants can get. Right? So, I mean, these are just a few of the products that we use. The one aspect I should cover before we end off on this is one of the things that's probably more than half the battle, it's actually senior to all these things, is the fear factor. Not to get political, I'm not going there, but I will tell you the mainstream media, they're into fear mongering. This is a serious situation. You guys, 99% of you are all going to be fine. That's kind of how the flu is also. 99% of the people are fine. The elderly and the immune compromised are the most at risk. But there's a lot of fear mongering where they take something that's bad and then they 10x it. And then people start watching the news, and then it's just like a buzzsaw. It just keeps coming out. This person, that person, that person. And when you really look at everything, it's not as bad as it really is being portrayed. So the reason I bring up the fear factor is that people get into anxiety. When you get a lot of stress and anxiety, your hormonal system starts to crash, and then that crashes your immune system. And when obviously you don't want to crash your immune system, because that's why a lot of people get sick with anything, is because of there's anxiety and stress. If you took all that away, we wouldn't have this pandemic, in my opinion. So basically, we use products like Mintran is one of the products we use. It's nicknamed the Happy Pill. Stands for Mineral Tranquilizer, which calms the system down. It's kind of a cool thing with that product. There's alfalfa in it, which is a plant, and that goes down about 15 to 30 feet, the roots of it, and it grabs other minerals and healthy substances and absorbs it into the plant, which they actually would grind up and put into that Mintran. So it's been nicknamed the Happy Pill. I've been threatened by many patients if I take them off Mintran, I might get kicked in the shins. So instead of wearing shin pads, I just leave them on the Mintran if they want.
So you're recommending that for, excuse me, anyone who's feeling extremely stressed right now, or in a stressful
nervous,
situation?
Anxiety, unhappy. Minchext, we don't have that product out there, but it has Mintran in it and other things. It's another nutritional tranquilizer, which is natural. There's another product that is one of our go-tos for Metagenics called Serenogen. It's an herbal product that people that are even who are sensitive that tolerate that very well. Because this whole thing, the stress starts breaking down people's adrenal glands, and when the adrenals start to go, then the immune system follows. So it's very important, to have that aspect of your body functioning properly. So again, as a recap, if you're a patient or someone, that's not a patient, sometimes your stuck points. Oh yeah, I don't move my bowels every day. But yeah, I get back pain, and my head, I used to have UTIs, urinary tract infections, or my kidney markers are a little off on my blood work. Then your kidney is likely a stuck point too. You can release those stuck points, get your bowels moving, clear the sinuses faster, and then obviously use immune support, because this particular virus does not like vitamin C or vitamin D. It has a hard time entering the cells per the research that's been shown.
Sorry, I won't step on the dog.
You can tell we're a professional outlet here. No award-winning cameras here for you, Francis. Anyway, now I lost my train of thought. But anyway, it's the drainage points of the body, and that's key in the immune system, and so you don't want to crash it. So I think that's pretty much what I wanted to cover.
Okay, so I just wanted to see if anyone had any questions that's watching us live. I know there was a couple questions last night when I posted you were going live. They wanted to know how much fresh squeezed lemon would be beneficial on the drainage aspect, because we've posted about helping with coronavirus, keeping things clean. They wanted to know how much lemon was one question.
Let me answer that one. You would, lemons are not big, obviously. You would cut it in half. If you're a medium or a bigger person, I would squeeze a half a lemon into your 8-ounce glass of water. If you're a smaller, petite person, like a third of a lemon is plenty.
Okay.
And by the way, too, this is actually really important. I was at a seminar 2.5 weeks ago, and this guy is quite brilliant and picked up some stuff. And he basically said that lemon juice, fresh squeezed, not pasteurized, annihilates viruses. So, it's obviously that probably doesn't have research, but I think that's something he's seen, clinically. So you would squeeze that amount in, and it actually, when lemon juice breaks down, which is citric acid in there, it turns alkaline, and the more alkaline your body is, the bugs hate, and they cannot thrive in an alkaline body. They thrive in an acidic body. How do you make an acidic body? Too much protein, which is probably the least of our worries. Okay, sugar, grains. Those are the two things that make your body acidic. So you're more apt to get sick because of acidifying your body too much. Okay, what was the next question?
Okay, and then someone asked, once a day enough on the fresh squeezed lemon juice?
No, not if you're sick or you feel like you're getting sick. Once a day is good for maintenance, but you would want to do that 2-3 times a day. If your stomach gets irritated, then you can cut it back.
Okay. And then someone asked, this was also yesterday when we posted that you were going live, they also asked, obviously there's essential workers right now,
right,
and being that they're going into the workforce, what do they need to take? What can they take from the clinic to boost their immune system?
Yeah, it's an easy answer if the stock was complete. Standard Process, which is, we use tons of companies, but our main company is Standard Process. They're back ordered on like 6 to 8 of the products that we typically use. So Immuplex is good. Still have Antranex and Black Radish. If you have any Cataplex AC, that's wonderful. Cataplex ACP would be helpful. Ceruta Plus. Some people, this is back order from Biotics. Ultravirix is awesome. If you have that, that's something that you could definitely take. Then there's Lung 80 from Systemic Formula. Cataplex C, which by the way is a whole food vitamin C, which wouldn't cause a deficiency like other vitamin C's would. So Antranex, Black Radish are always go-tos. If you're a patient, you know which ones work best on you. We went over Fengree, we went over the dairy, etc. So as a healthcare worker on the front lines, you'd want to do the same things that you would do with a patient. And one of the things that happens to tons of patients that we see, just tons of patients, they're dehydrated and don't know it. You get, sometimes you get hungry when you're dehydrated. The body gets confused. So you can just go by the dry mouth, etc., thirsty, but a lot of times you don't even get thirsty anymore. You get hungry or you don't even have the mechanism. So, and a lot of people I'll say you're dehydrated, or Dr. Schell or Dr. Koenigbauer will say, you're dehydrated, and they'll look at you and go, well, I drink like, a half a gallon of water a day. I can't be dehydrated. Yes, you can. Because a lot of people, the water goes right through your body. You're urinating constantly, just going in and going out, because you're lacking minerals and you're lacking good salt, which would come from sea salt. And if you add those things in, there's products we use too called Hydrate 2 and Rehydration that you can put drops in the water to pull the water into the cells, and that's another way that you can remove every single one of these stuck points. is because you're taking the inflammation off the body, and then voila, it helps get the body going again.
Okay, good. And let's just see if there's any other questions. Tricia Lynn says, thank you for the information. Aunt Vicky and Uncle Paul say hi to Skylar. Jackie I hope I don't butcher anyone's name. Wanner
Yeah.
says this is great information. Thank you very much, Dr. Jantz. Okay, so
the other thing, let me just interrupt you for a sec. Just everybody, if we can just stay calm. There is logic to the shelter in because it is a very contagious virus, and it spreads airborne from whatever thing that I've been reading and seeing. But it's also a virus, okay? And you don't really change the mechanisms and the principles of alternative medicine when it's a virus. If you do these things and you're not immune compromised and you're not elderly, and even if you are those two things, which is even more important that you follow all this, your chances go way up of staying well or being well and staying well.
Okay, good.
And again, we don't treat infection. We're just making your body work properly.
So it can do its job.
So it can do its job, exactly.
And for anyone, since we're closed, like most businesses currently right now, what are we doing to assist our patients or even non-patients that want to buy supplements, or what do we?
We're still we're considered an essential part, but we can't see patients unless they're emergency visits.
Okay.
So that when I say emergency, I mean we're basically trying to keep people, and really this is the fantastic thing about all this, you guys, is you want to take the stress off the ERs, because these guys, the ERs rooms in the hospitals are getting people, they freak out when something's in their lungs and they're not even that sick maybe, and then they end up in the ER, and then the people who are very compromised and sick sometimes don't get the treatment that they should. So if we can keep the pressure off of them, which I have great respect for the people who work in the ERs, they work under pressure. We have phone consults that we do. We also have your files if you're a patient, but we do phone consults for people, and we can recommend the nutrition. If they're not a patient, we can still do that because of the crisis and the times. There is a couple of staff at the clinic. They're just not letting people in the door, so you can drive by, or don't drive by, you have to stop in the parking lot, and just call in, and then one of the girls will run the supplements out to you, or we can mail them. We have a phenomenal mailman who comes by 4 times a day to take all the orders. So we're doing mail order. You can also order off of the email, and I don't want to recite Rochelle's email off the top of my head because it's on the recorder when you call in. So we're going to be available 7 days a week. We're going to try and keep answering questions and filling whatever people need until this passes.
Okay, let me just see if there's any.
She's checking to see if there's any more questions.
Kim Joy says, who's the cutie patient? Kim Joyce asks, can we get a consult via Zoom or FaceTime? Or, I think you just covered that via, we're doing phone consults.
All right, well, if there's questions, we're going to keep posting, and I'm going to keep doing this because this seems to be fruitful, and I believe we had about, 500-600 people that were already liking this and wanted to come on, so it'll probably grow, and I'll just do everything I can to help you guys. That's what we're here for.
And then Kim Joyce says, can you put together an immune pack for us? We have done that.
Yeah.
And again, they can call into the clinic at 313-881-7677. They can set up appointments for phone consults, or the girls are taking phone orders, correct?
We're charging a very modest fee for the phone consults.
Very.
But basically, when you guys call in, you're probably going to get me coming back, or Dr. Jeff or Dr. Shell coming back 2-3 times sometimes with, well, what about this? What about that? We'll probably have to derive a little information from you, especially if you're not a patient. All right, well, I think I'll end off here. I appreciate your time. I appreciate my wife holding the camera and filling in, and we appreciate Skylar because she got out of bed.
I did.
And helped us out.
I'm so tired.
Teenager, you guys. Back to bed.
Yep.
Signing off. Stay healthy, and we'll see you soon.
Have a wonderful day.